Flu affects people with dementia very differently to healthy adults. What might seem like a routine illness can have a much deeper impact on someone living with Alzheimer's. When the body is fighting infection, the brain is under stress too. In dementia, this often shows up as sudden confusion, agitation, withdrawal, changes in speech, mobility problems, or a noticeable drop in daily functioning. This can be frightening for families, but it does not always mean the dementia has suddenly worsened. Flu often brings fever, poor sleep, pain, and dehydration. These factors can trigger delirium, which may look like panic, hallucinations, restlessness, or a complete shutdown. In people with dementia, delirium can take longer to settle, and sometimes recovery is incomplete. Eating and drinking often become harder during illness. People may forget to drink, struggle to swallow, or lose interest in food. Dehydration is one of the biggest risks and can make confusion much worse very quickly. Support during flu should focus on comfort and monitoring. Small, frequent drinks are often better than full glasses. Warm fluids, soups, and foods that are easy to swallow may be better tolerated. Rest is essential, even if the person becomes unsettled or resistant to lying down. Over-the-counter cold and flu remedies should be used with caution. Many contain ingredients that can worsen confusion or interact with dementia medications. Paracetamol is usually the safest option for pain and fever, used at appropriate doses and regular intervals. Flu is caused by a virus, so antibiotics do not help unless there is a secondary infection. If symptoms worsen, breathing becomes labored, fever does not settle, or there is a sudden collapse in function, medical advice should be sought. It is important to remember that temporary decline during flu is common. With rest, hydration, and supportive care, many people regain some of the function they appeared to lose. Caring for someone with dementia through flu can be exhausting and worrying. Staying calm, keeping routines as steady as possible, and focusing on comfort can help both the person who is unwell and the carer supporting them. This content is for general awareness and education only, and is not medical advice. If you are concerned about symptoms or deterioration, seek guidance from a GP or healthcare professional who knows the individual situation.